you doing? It's your girl,
Sylvie J.
with Sylvie Directs. Welcome back. Thank you for being here. And for those of you who are new, welcome to our channel. We want to get started with part 1 of our series. Our general series topic is who's taking care of you? And today we're going to be delving into the roles, their key responsibilities, their education background, and the of physicians, physician assistants, and your nurse practitioners. So let's get started.
In modern healthcare, we have a diverse team of professionals that work together in order to provide all the care that you would need as a patient. First, let's talk about physicians. You might have heard there are 2 types of physicians. If you look at their name tag, you'll see the letters MD or the letters DO after their name. MD just stands for medical doctor, and DO stands for doctor of osteopathy. The main difference between the two is how they're trained. MDs or medical doctors follow the allopathic approach to medicine. This approach is all about finding and treating specific diseases and their symptoms. They do this by using medicines, surgeries, and regular medical treatments. This approach really relies on using medications and advanced medical tools to help patients get better. Doctor of osteopathy, or DOs, have a special way of practicing medicine. They look at your health as a whole and really focus on preventing problems and letting your body heal itself. They also learn how your muscles and your bones affect your overall health. They use a hands-on method called osteopathic manipulative treatment, or OMT. They use this to figure out and treat and stop illnesses or injuries related to your muscles and your bones in your body. This technique is used to improve blood flow, to lessen pain, and to help your body heal better, more naturally. Not that all DOs use OMTs, but it is something special that's connected to the osteopathic profession. Their path is pretty much similar. They pretty much specialize in different fields, from surgery to pediatrics, which work with children, then some in primary care, some of them internal medicine, family medicine, gynecology. They can specialize in different fields. Moving on to physician assistants, I want to make this disclaimer. We don't want to confuse the physician assistant role with the medical assistant role. We want to make sure that we understand the difference between these 2 roles. I will be talking about the medical assistant in a different video. A physician assistant, or the PA, those are providers that work with physicians. They are also skilled in diagnosing and treating medical conditions. They can order tests. They can perform procedures. They educate patients. They collaborate with the healthcare team and can provide care in emergency situations. These are some of the key responsibilities that a physician assistant can do. Now, that's not a full list. One of the key responsibilities of nurse practitioners, they provide primary care. You can also see them in the acute care setting or the hospital setting. They provide emergency care, pediatric care, and they specialize in mental health, in cardiology, for example, in neurology. If a specialization exists, it's likely that you'll find a nurse practitioner in there. They provide your treatment for whatever the condition is. They diagnose, they order tests. They're also known for their ability to advocate for their patient. They give patient educations, and they also collaborate with other providers. Are you seeing a trend in the duties and the roles between the three? They are all responsible for diagnosing and treating medical conditions. They all collaborate with other healthcare professionals, and they all provide education. While there are similarities between the three roles, there are differences. Let's talk about the education requirements for each one of them. Each physician do a 4-year bachelor's degree, their undergrad degree. Then they're going to matriculate through medical school, or they can go to a DO school. Both of those are equally 4 years. After they finish medical school, they do something called residency. Some of them even do a fellowship afterwards. Their residency can be anywhere from 3 years to 7 years, depending on what the specialization that they take. Let's be very specific with cardiovascular surgery. So a physician who's going to be taking that track, their residency will start off with general surgery. And however long general surgery is, that's how long they'll do it. So general surgery residency is 5 to 6 years. Then they'll continue to do 2 to 3 more years to do cardio, a very specific type of surgery. PAs also do their undergrad degree, and then they matriculate to a PA program and finish with a master's degree in PA. They do clinical rotations, and a physician assistant will need or will have about 2,000 hours of clinical experience by the time that they graduate. Where they'll do primary care, some specializations, where they'll probably do some surgery, do rounding in the hospital. Let's talk about the nurse practitioner. A nurse practitioner has an undergrad degree as well. Then they apply to a nurse practitioner schools. Some programs can be from 2 to 3 years. The nurse practitioner programs can either be a master's level or a doctoral level. If they do a doctoral program, that degree is called a DNP, which stands for Doctor of Nursing Practice. The total amount of time the nurse practitioner will do is about 600 hours. While that seems significantly less than everybody else, I want you to keep in mind that a nurse practitioner also have finished their registered nurse degree, which I failed to say. On their undergrad degree, they have a lot of clinical hours. So take those hours in combination with the 600 hours. That's a lot of hours for our education. Some nurses continue directly to the practitioner's program. Some continue practice as registered nurse instead of going directly into the program. And that also adds to the experience that they have, or the clinical hours per se that they have, and the knowledge in medicine that they've procured or that they've acquired. All three of them come from different education backgrounds, but at the end of the day, they do what they do to take care of us. All three will make sure that whatever your needs are medically, that you have them. The physicians have a high level of autonomy, and they're often the leading person in the healthcare team. The PA work under the supervision of the physician. While we say under the supervision of, it does not mean that if you walk into your clinic right now and the physician assistant is seeing you, there's not going to be a doctor behind your physician assistant looking over his shoulders, being like, are you doing what you need to be doing? It doesn't work that way. It really doesn't work that way. But the supervision is there because, again, the physician does have a higher level of education, and we're working in collaboration. So there are so many things that we as advanced practice providers can do, and we don't really need some magnifying glass, and that's not really how supervision works. There is a complete trust between us to take care of you. Everybody is in agreement as to the movement of your care. And then the nurse practitioners, their autonomy is a little bit different than the physician assistant. Their autonomy varies, and what dictate whether or not they have full authority to practice alone or with the collaboration of a physician depends on the regulations of the state. So there are some states that a nurse practitioner have the authority to practice alone, and there are some states where it's not so. Some states which give complete liberty, and we call those the green states for nurse practitioners, to practice and work independently. Some, which we call yellow states, in which the collaboration is not so free, but it's not so strict. And then there are the red states, which means that the practice is regulated in those states. So it all depends on where you are, and that will determine the way that your nurse practitioner will be practicing. I just want to recap some of the things that we talked about: the roles of physicians, PAs, and nurse practitioners. And we discussed the difference between their practice, their scope, their education and training. And I want to make sure that we understand that there is a big emphasis on the collaborative nature between all three roles. We all need each other, and we all work together to make sure that you are well taken care of. We all play a unique role, yet we contribute to the diverse teams, and we're able to get the same outcome. And the outcome is always the best care for you.
I hope you enjoy. Thank you for stopping by. I would love to hear from you. Let me know what you're thinking. Let me know if you have any questions, and I'll try to integrate some of your ideas into our conversation. In the meantime, be good, be blessed, and I'll see you next time.